Okay, good morning, a good afternoon, and good evening to everyone. So my name is Tessa Kegel, and this is the second event in this online seminar series for the Work Disability Prevention and Integration for this year. So I'm a researcher in Melbourne, Australia at Monash University, and it's 10:30 at night here. I know people are joining us from the mornings and from the afternoon, so welcome everyone. I'd like to remind everyone who's just joined us, if you could mute your microphones, we will have a lot of opportunity for question and answer after our presentation. Now, I'd also like to remind you that today's presentation will be recorded. So a copy of the seminar will be made available on the via the Scientific Committee website, and that's at www.wdpi.net. And we'll put that into the chat, but we'll also send out emails to people. Okay, so now it's my very great pleasure to introduce to you Dr. Margot Joosen. So Margot is a health scientist and holds a PhD in occupational medicine on the topic of work and health. She currently works as a senior research leader at Tranzo, Tilburg University in the Netherlands. Her research focuses on how to strengthen mental health at work and sustainable employability, especially for healthcare professionals. She's also interested in recovery and return to work among different patient groups, such as cancer survivors, trauma survivors, people with common mental disorders, and complex health problems. Other research topics include disclosure of mental health issues in the workplace, stigma and discrimination, and interpersonal skills of professionals. Margot also supervises several PhD students and postdoc researchers in these areas, employing diverse methods such as interdisciplinary research, mixed methods designs, implementation research, and realist evaluation. Margot was part of the Work Disability Prevention CIHR training program as a fellow and a student between 2013 and 2015. And recently her team won the 2022 Dr. Michael Firestein Best Paper Award for her paper, Barriers and Facilitators for Return to Work from the Perspective Workers from the perspective of workers with common mental disorders with short, medium, and long-term sickness absence. So this was a longitudinal qualitative study. It's my very great pleasure, as I said, to introduce this seminar. Now we'll have, as I said, lots of time for question and answers after the seminar. So if you could put your questions either into the chat or into the Q&A, and then we'll discuss the seminar after Margot has presented. So over to you, please, Margot.
Thank you, Tessa. Thank you for this kind introduction and also for inviting me for this webinar. I'm really honored. You already introduced me, so I think I will just start my presentation. I will see if I can share it. Please let me know if you all can see it. Can you now see the presentation? I don't think so.
Yes, we can see your presentation, Margot. Thank you.
Oh, you can see it? Okay, good. Because I cannot see
it now.
Now you can see it?
Yes, we can see it now.
Because I cannot see you anymore. But maybe that's that's okay. Only I have a first. Actually, I want to start with asking the audience a question, and but I will first introduce a little bit more about myself. I will talk about aligning work with values. We are doing some research on that and how to enhance mental well-being at work, and what the role of the supervisor is in that. I will also shortly discuss the paper which we have been awarded with the Michael Feuerstein Award, which we are very honored. And then I will also continue with talking about a new project, a new line of work that really focuses on the meaning of work. And actually the first question is actually for you as an audience. So I would want to ask you, so imagine you would win a big lottery prize today. So it's a really huge prize, like really big price. So why would you go to work tomorrow? And I now see there is something with it continues automatically. So I will just see if that doesn't disturb my the pace of my presentation, but hopefully this will go all right. But so the question for you: why would you go to work tomorrow if you win this big prize today? So you have these buttons in your screen, the emotions, where you can click on clap or a thumbs up or like a heart, like a heart. So please now use those emotions. If you would say, well, I would go to work tomorrow because I would like to develop and use my knowledge and skills. And then you have the clap emotion, or put a thumb up if you say, well, I go to work tomorrow to contribute to something valuable, or a heart if you say, well, I wouldn't go. And I will just check if I can now see you or see your emotions. Yeah, I can see some claps there. Maybe Tessa or David, you can help me if you also see emotions in the from the participants.
I can see a few thumbs up.
Yes.
Yeah.
Okay. There's a few claps. Also hearts there showing, or no hearts? Well, the point here is that oh yeah, I can see. Oh yeah, I can also see in some claps and good. Well, the point here is that even in this small group, you can see that there are differences. Some people use say, well, I go tomorrow to develop my knowledge and skills. And others will say, well, I go to my work because I want to contribute to something valuable. So what this already says is that people value different things in their work. And maybe they also need different things to develop, to realize those things that they find valuable. So people are different in why they work. That is the one thing I want to start with. And keep that in your mind while we have this presentation. So my presentation and my work focuses on the healthcare professionals. So we know in healthcare that the healthcare sector faces difficult times with high work pressure, high sickness absence levels, and high turnover. And actually, a few years ago already, it was by the World Health Organization already mentioned that we need to have a more larger workforce because we are facing shortage of healthcare workers. And they also recommend that more attention should be given to the retention of healthcare workers. And but the question is, so how do we do that? How do we focus on keeping the people motivated in their work? And how can we prevent people from leaving the job, from feeling burned out, and from calling in sick? So we have done some research, and this is actually the paper which Tess already mentioned, where we received the Michael Feuerstein Award for Best Paper. And what we did here is we wanted to learn more, gain more insight into what caused sickness absence in people with mental health problems from the perspective of workers themselves. And so what helped them, and also what helped them to return to work and what didn't help. So basically, we wanted to know why do some people return to work swiftly and others remain on long-term sickness absence. So we used a qualitative longitudinal design to research this. So we interviewed 34 workers with mental health problems, and we interviewed them twice during their sickness absence and recovery period. So, and to share some of the main topics that we found is that so this is all from the worker's perspective. So when we asked, so what actually caused your sickness absence? One of the main topics that emerged was that workers perceived a high workload, and that was the primary cause of their sickness absence. And interestingly, they mentioned that there is a distinction between actual workload and perceived workload. So with actual workload, they mentioned, well, I had like tight deadlines. I had to work, make more hours. I had to do more tasks than were possible for me in my working day. So that's actual workload. But they also mentioned that they had perceived high workload, and that had it also to do with self-imposed workload. So being very perfectionistic, having a high responsibility, feeling of responsibility. And specifically the perceived high workload would differ between people. So some people like to have these deadlines, and other people, they get really stressed from deadlines and long working hours. So that was our first insight, that workload can be perceived differently by different people. So a second topic from this research was that none of the workers that we interviewed mentioned that the sickness absence was caused by their mental health condition. So they didn't regard the mental health condition as the origin of the sickness absence. They saw it more as a consequence. Because they experienced a high workload, they at one end they couldn't cope anymore, and they called in sick, and actually the mental health illness was a consequence of that. And we thought it was a really interesting insight, because in the literature, but also in our for employers, we often talk about sickness absence because of mental health issues. And this also implies there that the problem is the individual, the person with a mental health condition. And from our research in work and health fields, we of course know that that interventions should be targeting the work environment. But it might also made us think about, okay, maybe how we phrase the cause might also be important to realize that it also has an implication that it's more about the individual, while we know it's more than the individual. It's a complex problem. So when looking more into what helped workers to return to work, a supportive manager was one of the major topics that people mentioned, and that would be very, very helpful, supportive manager. However, they often experienced that they felt that the manager was not supportive, and put more pressure on them to return to work when they were not ready for that. So actually, we also noticed from other research that it is the manager has a key role actually in the relationship and the communication between the worker and the line manager, that has a really impact on mental well-being of workers, but also on sustainable employability. And finally, what we found was actually we saw a little bit of a difference between those persons that were on long-term sickness absence and on short-term sickness absence. And the people that were on long-term absence, they actually mentioned, well, when I look back, actually I don't really enjoy my work anymore. The content of my work is not really fulfilling anymore. So what they actually said is, my work has changed over the years, for example, and it doesn't really fit me as a person anymore. So there is actually for years going on a mismatch between the person and the job. And that actually led to perceiving this high work load and also impacted the sickness absence. And also they mentioned, well, when I have to return to my work again, it doesn't really help that I have to go back to work that I don't really like anymore. And this was actually also for us an insight, because often action is just people managers or take action when a worker faces sickness absence, and this actually shows that if you could discuss the value of work or what work means to people or the content of the job, if that still fits the employer, that you might be able to also prevent sickness absence and mental health problems. So that was for us, it was really an interesting insight, and also gave us the idea to dive deeper into this topic of the meaning of work. Because what we see also in light of stresses, when you have actually a staffing problem, or when you have high sickness absence levels in your organization, there's often little attention for the positive aspects in work, such as strengths or positive experiences or the value of work. And that's actually a shame, because we also know from research, such as from the positive psychology literature, that focusing on these positive experiences can be a real added value for the motivation and engagement of workers. Also from other research, we know that people who do work that is of value to them, that they really find important, that those people feel mentally healthier, are more productive, and take less sick leave days. And also from our own research, which I just described, we see that supervisors can have a key role actually in this, by facilitating conversations about values and what people actually need, and not reactive when when there is a problem, but proactively actually, just as a normal regular conversations between a worker and a supervisor. So my point is here that it might seem very logical and obvious that to focus on retention of workers and to strengthen mental well-being and sustainable employability, we should actually find solutions that really fit the values and needs of workers. However, this is actually is rarely being done in practice, and sometimes we also see the opposite. This was a funny example, I think. Here it says, well, physicians spend 30% of their time on documentation, nurses 41% on documentation. It's incredibly documentation burden, and it's part of the reasons why people leave their job. So why actually are we then designing these solutions that take away the human touch of care? So it says actually, why are we finding solutions that are not in line with what people value in their work? So that is why we have designed an intervention, or more say a method. We call it work values intervention, or work value methods. And we want to actually promote well-being, mental well-being, and work engagement of healthcare workers in this case, by actually providing opportunity for workers to achieve important work goals, or work values, so we call it. Those things in your work that you really find important. And we train supervisors to provide those opportunities, because we know that supervisors have this crucial role. So we help supervisors or managers to create value of work for the individual healthcare workers or for the team, by having regular conversations with them about what do you find important in your work, and what do you need from your work environment to realize those things that you really find important. So this intervention contains of 3 main steps. So first, we assess the important work roles or work values from a team of workers, and we analyze work contextual factors that influence those work values. So basically, we talk about what are your individual but also team needs actually to realize those things in your work that you find really important. And after that, we set up a plan of action with the team that addresses those needs. And we train, as I mentioned, supervisors in using this work values interventions by having team conversations. That is the main things that the main focus, having team conversations with small groups of workers, 6 to 8 person, and talk about these work values and needs. And what we also do here, we take an integrative approach. So we involve important stakeholders within the organization. So we focus on the supervisor, but also higher management levels are involved, but also HR professionals and learning and development departments, so that they're all on the same page as it comes to this intervention and this method. So these team conversations are very crucial, and we train supervisors in how do you have these good conversations? What is actually a good conversation? And there is basically we train supervisors to ask 3 questions in these conversations. What do you find important in your work? What do you need to achieve that? What do you need from myself as a supervisor or from your work environment? And what can you do yourself? What is your own role and responsibility in that? And by having this kind of conversation, you really get a positive conversation. It has the focus on goals, on future, and it's not about making a problem analysis. It's the opposite. It's about talking about what gives you positive energy in your work, and how can we improve that. And for supervisors, it's quite difficult most of the times to ask questions and then just listen, not providing the solution for your workers. That's the main thing that we have to teach these supervisors. So to give you a little bit of insight in what we are doing, we made a video clip. It is in Dutch, but there is English subtitles, and I hope the sound now. I will first check if I think it will work, and you can also hear the sound. So I will show you the video. Oh.
De zorgsector kampt met hoog ziekteverzuim, verloop en tekort aan zorgprofessionals. Het wordt daarom steeds belangrijker om aandacht te besteden aan het behoud van zorgprofessionals en hun mentaal welzijn. En met de werk als waardemethodiek proberen we daar juist een bijdrage aan te leveren.
Ja, we hebben meegedaan aan de werk als waardemethodiek en daarin hebben we met onze teamleider teamgesprekken gehad over welke werkwaarden we belangrijk vinden in ons werk.
Door deze teamgesprekken wilden we vooral met de medewerkers in gesprek gaan om hun gehoord en gezien te laten voelen.
Het heeft mij persoonlijk eigenlijk 3 dingen opgeleverd. Als eerste dat ik me gehoord en gezien heb gevoeld door zowel mijn teamleider als door mijn collega's. Daarnaast heb ik ook dus geleerd wat de werkwaarden van mijn collega's zijn en kan ik hun dus beter begrijpen in de keuzes die zij maken. En als laatste heeft het ook de werksfeer hier op de afdeling verbeterd.
Het is heel mooi en hoopvol om te zien dat je met zo'n kleine interventie, namelijk een goed gesprek tussen leidinggevenden en medewerkers, al zoveel teweeg kan brengen.
So this is a very short clip. We have longer versions, but just for this webinar, I chose to present the short version. Hopefully it gives a little bit of an insight what we are doing here. We also conduct research on this method. So what we want to do in our evaluation study is we want to know what are barriers and facilitators for implementing this kind of method in a hospital care setting. And we want to know what are the effects of this intervention on mental well-being and work engagement. And we implemented this intervention in 15 different hospital care units in the southern part of the Netherlands. And we used a mixed method design. So we collected data via questionnaires among supervisors and healthcare workers that participated in the intervention. And we also conducted semi-structural interviews. And in the interviews, we wanted to learn more about the perceived effect and barriers and facilitators from the perspective of people that, that participated, both supervisors and workers. So we are still working on the data, but I can give you some preliminary results and information. So we have healthcare workers, and we have almost 400 healthcare workers that participated and filled in our questionnaire on baseline, and 40 supervisors that were divided among those 15 hospital care units that supervised their teams. And I want to give you some insight in one of the questionnaires that we used. And this is a questionnaire. This is called the Capability Set for Work. And this is a relatively new but validated questionnaire to measure sustainable employability. And in this case, sustainable employability refers to being able and being enabled to achieve valuable work goals. So in this questionnaire, it captures 7 work aspects or 7 work goals, such as using knowledge and skills in your work, or contributing to something valuable, or setting your own goals. And with each of those work aspects, 3 questions are asked. So it's asked, how valuable do you think this work value is to you? In what way are you enabled by your work context to achieve this work value? And the third question, can you actually realize this? Can you achieve this work value? And on each of the questionnaires, you can score 1 to 5. So as I mentioned, this is a if you want to read more about this questionnaire, we are doing some psychometric research on this questionnaire, and this is one of the recent publication. So using this for the healthcare workers, you can make a visual, make the data visible using this kind of web. So here you see the main scores of the 391 healthcare workers. And in the outer ring outside, you see the 7 work values. So use of knowledge and skills, development of knowledge and skills, being involved in important decisions, building meaningful contacts at work, setting your own goals, having a good income, and contributing to something valuable. And the blue line here, that shows the levels of importance, the main scores, and the higher the score, the higher the importance. And the cutoff score of 4 is considered of value or high score. So here you see that actually these healthcare workers, mainly nurses, find all work values important. But the interesting thing is when you look at the other lines, the red and the green lines, because those represent if they have the feeling that they are facilitated by their work context to achieve those work values, and if they actually can realize those things that they find important. And here you see that there are gaps between what people value in their work and what they are and in what way they feel they are enabled and they are able to achieve those things. So the main gaps you see here is between having a good income, development of knowledge and skills, you can see a gap, and involvement in important decisions. So we use this as in our research method, but we also use this questionnaire in the intervention actually. So for supervisors, they also use this questionnaire to gain insight in what do my people in my team value in work, and what actually, where are gaps in what we give them, or what kind of opportunities are we giving them, and what they value. So then the supervisors have these team conversations, as I mentioned, and afterwards we did some qualitative interviews. So with 16 healthcare workers and with 9 supervisors. And I will give you some preliminary results from the interviews with the little bit combined, but mostly of the workers. So we asked them what is the perceived effect? What is the impact of you participating in this work values intervention, and specifically how did you experience these team conversations with your supervisors? And what we saw is that one of the main topics is that people are feeling heard and seen. So this is one quote of a participating nurse. So the value of these team conversations is that you talk to each other at a quiet time about things you don't talk about in coffee breaks. You can dig deeper into things. Being listened to is very valuable. Another topic is that they said that they felt they better understood themselves and each other because of these team conversations. It has given me more insight into how colleagues think about things, and that you can take that into account and learn from it. It has made me think differently, more openly. The third theme is respect and improved atmosphere. The feeling that I'm in a team that respects each other and a team that excludes no one. I think that actually is the biggest value it brings to me. And actually we were quite surprised, or we were really great to hear that this is actually one of the so-called effects or impacts from just having a good team conversation. And also a stronger team. So people mention, well, work values certainly contributed, and also those actions that were taken afterwards to make sure that you're just more of a team, that you're strong enough as a team. So actually, we didn't really realize beforehand that that these topics, like the feeling heard and seen, being recognized as and valued as a worker, that was such a powerful aspect from these team conversations. And also the better understanding part, where we have these group conversations. So 4 to 6 people, where colleagues really just get to know each other better about what they find important in work, but also why they make different choices in their work, for example, and that you can respect that better. Yes. So what are the main preliminary conclusions? Because we are still doing analysis on this. So what we saw here in this web, we saw that healthcare workers actually cannot really achieve those values that they find really important. But we also saw that this kind of intervention, this work values intervention, seems to be very feasible to implement in the hospital care setting, and that by doing this, you can identify important work values and needs. And afterwards, healthcare workers mentioned that they experienced mutual understanding and respect and feel heard by their supervisor. So what we saw, that working elements is what we think that are more important working elements in this intervention is sincere attention from the supervisor. So just having a good conversation, listen to your workers, ask them questions about what they find important, and then don't judge what they answer. And also, working element is the integrative approach within the organization. We are doing this at a level of the direct supervisor and the healthcare workers, But by having the HR department involved, and also learning and development and higher management level, supervisors also feel supported in doing this intervention and applying this method. So what are takeaways for now is that this study actually contributes to what is needed for healthcare professionals to stay motivated and engaged and healthy at work, especially in these challenging times. And we also think that this intervention is one of the few positive psychology interventions to enable personally meaningful work values. And that we also see that it is feasible in practice. And this is actually a value-based approach, and we think that it has an enormous potential also for other sectors actually to strengthen well-being and healthcare, well-being of workers, because it's a very generic approach which we now applied for healthcare workers, but basically it is you can apply it in all different kind of sectors and tailor it to the needs of teams and organizations. So next, what we did is we wanted also to, of course, we want to spread this word, and what we did is we made a toolbox for this intervention, targeted healthcare of HR professionals and supervisors and healthcare organizations who are interested in also applying this. So we made an online platform with a workbook and infographics and checklists, a questionnaire that employers can actually use in their organization, and also some knowledge clips and videos where like the trainer explains what she is doing and why it's important to train supervisors and so on. So we're not only doing research, but we also want to create impact and want to exchange our knowledge to actually practice. And I want to close with this picture. And this is actually really reflects our intervention, or what we aim for. This is picture, it comes from the capabilities approach, which is one of the approaches and theories that we use for the development of this intervention, which is developed by Amartya Sen, a Nobel Prize winner economist. And it's a well-being theory or approach, which actually says, well, that if you are if you can be yourself and you can do the things that you really like to do, that really, and you have choice in that really influence your well-being. And colleagues of us have translated this capabilities model to the work context. And what you see here in these pictures is the left picture. It shows actually how it usually goes in organizations, in all kinds of organizations. When you want to reach a certain goal, then equal means are being given to workers. So here you see that these three boys, they want to watch a football game. And from the principle of we treat people equally, the stairs that they received are of equal height. But you see that for the left person, for the big person, he just receives too much. And for the smaller person, he just receives not enough to actually reach his goal. So what we actually want to do, and what you also want to do in this work values intervention, is we want to create equal opportunities. We want to give people equal opportunities to reach their meaningful work goals. So that sometimes means that you have to divide your means unequal. So for in this example, for watching the game, the taller guy doesn't get anything, and the smaller person receives more than other person. And we see in organizations that for supervisors and healthcare professionals, it can be really difficult to treat people actually unequal, or to give different means to people, because then other workers might complain that they also want to get something. So one of the things in the training and in this intervention is that you really make clear why you do this, and that you really give equal opportunities, and that you really match your interventions with the needs of individual workers. Because as we started with the question about the lottery, the people value things differently in work, and that people might also have different needs in how they realize those things. So I want to thank you for your attention, and I'm happy to answer questions if you have those. So I will also stop sharing now, and then see you again.
Margot,
Yes.
thank you so much for such a wonderful presentation. So we'll open the floor up for questions now. And please, if you could remember to unmute yourself when you're asking your question, or put a question into the chat or into the Q&A. And also, if you could just let us know who you are and where you're from when you're asking your question. So please, over to everyone. Okay, so and while people are getting their questions ready, I'm going to take the opportunity to ask a question myself. So yeah, as I said, thank you so much for a fascinating presentation. Now you mentioned that you wanted to make sure that there was non-judgment when workers were expressing what their values and so on were. Did you find that was there concern about that from some of the workers? Did they feel that they had that trust, or did you need to work on that trust as part of your program?
I think what we saw is that was a main learning goal of the supervisors in the training on how to implement this intervention, so in some teams, you feel that there is like this, that there is something going on, and then it needs extra attention. But actually, this intervention by itself, asking questions about what do you value in your work, is actually this typical question where you actually cannot really judge, right? I can say, well, if you find that important, I don't find it important, but well, yeah, that's the way it is. So I think the way we ask the questions really helps to make this safety. And at the same time, we really instructed also the supervisors to, for example, make sure that you are in a quiet room with no distractions. Make sure that you mention that whatever is said in this room stays in this room. And also, one very important thing is to give the right example. So for a supervisor also to be vulnerable, actually. And so it's not really just not a question answer between supervisor and worker. It's more of a group conversation where the supervisor facilitates, and he or she really has an important job to make sure that from the first moment he is also in a vulnerable place, and make sure that whatever you mention, no one will judge. But of course, for this also has to grow.
Wonderful. Thank you very much, Margot. Any other questions from anyone else?
Yeah, I can add a question specific to the cohort you looked at, which seemed to have a lot of nurses in, or a lot of health professionals. So I was thinking about the type of people that go into those jobs and thinking about what they might value. It seemed like a lot of the results you shared were probably quite generalizable to a range of different occupations. But thinking specifically about the nurses, and when you asked the question to us on the call, which are mainly researchers, I think about those as being sort of vocations or jobs that people are called to for a specific purpose, and the healthcare workers may want to help patients, have a caring side to them. Was there an opportunity for some of those some of those sort of features to come into your results, or did they just not did those sorts of things not come up as being important?
You mean, yes, because because I showed the web and you see that all those things, they score high, you know, they score high on all the 7 work values. But in the conversations, yes, what the nurses mainly value is having contact with your patient and taking care of your patients. And that is something that, because of shortage of personnel, but also the high work pressure, more complex patients, it sometimes is difficult for them to achieve those work values. Because we definitely saw that more typical things that they find important. But in the end, it doesn't, in the conversation, in the intervention, it doesn't really matter what actually how many things you find important, because when you say, well, this is my main work value, this is something that I really find important, really value, then it's equal important. Then you say, well, I value all those things. So it doesn't really, it's not like quantifying, it's not like we don't try to quantify. It's more of a qualitative way of looking at it.
Thanks.
So any other questions from people? Oh, I think there's a question in the chat. So Di, would you like to unmute yourself and ask your question yourself? And hello. Sorry, Di, we can't hear you at the moment. Okay, so I'll ask Di's question. So Di says, thank you for your presentation, Margot. Very interesting and important for healthcare. Actually listening in an empathic way to your team as a quality that is being shown to be important for a manager and leader within an organisation, and one that is important for workplace mental health. So thank you for your work and helping to get the message out there. Oh, and Di sends apologies. She's not able to talk herself at the moment.
Okay. Well, great to hear that. Yeah, great to hear that it's well, for this response. I think personally that for us it also has made our eyes, opened our eyes about how important communication and relationship between supervisors and workers is. At the same time, I think we also have to be realistic that this is one way of doing this. It also isn't the solution for all problems, but I think it can contribute to actually to strengthen well-being and sustainable employability. And also it can contribute to afterwards selecting or choosing, okay, what are then strategies that we need to focus on in an organization. So I was also actually wondering if I can ask you a question about if you, from your research experiences, also maybe from in your own country, that you think that this kind of meaning of work and value-based approaches do you see that there's more attention to that, or is it common to you? For us in the Netherlands, it's quite a different approach. But it's upcoming because of positive psychology theories. I was wondering how that is in other countries. Someone wants to comment?
Can anyone comment on that? Actually, we'd be particularly interested if anybody could respond from a healthcare perspective. I can imagine. Margot, did you find, or do you have the notion that this would be very different from industry to industry?
Well, actually, we are not us as a researcher, but with we work with these the person that does the training is she is very experienced in in using this kind of training interventions, and she does this in actually all kinds of sectors. So also in industry or label work. I think that's also one of the strengths, that it can be easily adapted to different sectors or different organizations or teams. And you might get different conversations, or might want to adjust a bit how you are doing this or how you train supervisors. But in the end, the basics are the same. So we have some experience with this, but it's not well spread yet. It's not. Yeah, it's not. No.
Yeah. No. Really interesting. And it's certainly not an approach that I'm enormously aware of in the Australian context. However, when I think about my colleagues, I work in an academic institution. When I think about my colleagues, I think many of them are quite motivated by values, and I think there are many different types of values, but it would be very value driven, I think.
Yeah, good.
We've got another question. No, not yet. So I'm going to exercise my privilege here and ask. So I know that you said that you've developed many different tools for management organisations and so on. So has there been much interest in this from other hospitals, outside and larger than the actual program?
Well, yeah, we just only recently launched this toolbox. So this is actually the time to actually see, okay, what kind of responses do we get? And for example, yesterday we gave a workshop for like 15 different healthcare organizations, and they were really enthusiastic about this. And what they actually mentioned, that because it sounds really simple, right? You just ask people what they need, and then and it is quite simple. But what they also mentioned is that, yeah, we are not doing this. And when we see with our HR processes, for example, we have all kinds of different interventions and methods where the employees can choose from that. So, but that's really from this is what we have. This is like the menu, and you can choose. While our approach has a different way and starts with actually what do you need, and then aligning the interventions to what people need, and they saw this different. They really saw that it's a different approach. And they were very enthusiastic. So we hope, yes, that more and more people want to experience this. And from a research perspective, this was actually the first time we tried this in a real world setting. It really worked very well within this one hospital. Different kind of hospital, different kind of unit. So from surgery to different kind of hospital care units. But of course, from a research perspective, we would also like to do this again, and maybe in a controlled research setting where we have a control group, because we didn't have that. So we have a wish list to continue with.
I certainly am looking forward to seeing how this progresses. So be interesting to see if you do see differences in terms of retention of staff and so on.
Yeah, exactly.
Probably coming towards the end. Any final questions from anyone? I think Daniel, you have a slide to finish up. But before we do that, if I could thank Dr. Margot Joosen again, such a fascinating study. Thank you so much for your generosity in sharing everything with us.
Thank you.
I'm going to join the clapping with that. So thank you so much. And
thank you.
How your project develops. Over to you, Daniel.
Thank you. Just wanted to quickly mention that this event will be made available online, a recording of it at www.wdpi.net, and you can also see the past webinars there. We have another webinar planned before the end of the year. Peter Smith from Toronto will be giving a talk, and we'll be looking for ideas for next year. And if you have any ideas of future seminar speakers, please email them to me.
Okay.
And thanks again, Margot, and thanks, Tessa, for chairing. Thanks everyone else for attending today. Take care.
Thank you.